Okay, so this is our second video of how to fill out a diagnosis and treatment plan sheet. If you're seeing this video, this is the second video. This is the video where I'm going to be dictating two examples of two different patients. If you are seeing this video, you should have seen the first video already where I provide an example of how to fill out one of those sheets. And this second video is an exercise to practice filling out those treatment plan sheets. So if you have your treatment plan sheets ready, we're going to get started with the first patient. So this is going to be the first example, example 1. And for this patient, make sure you don't fast forward the video. We're going to be dictating the findings. And at the end of the example, I'm going to let you compare your notes with the ones on the screen. So the patient's name for this first example is Gloria Thomas. Gloria Thomas. And the patient's date of birth is 9/17/77. It would be September 17, 1977. And the reason the patient is coming to the office is because she would like to replace missing teeth. So that would be the chief complaint of the patient. I would like to replace my missing teeth. In the observations box, we're going to enter the blood pressure, which in the case of this patient is 119/79. And we're going to get started with the treatment plan. So enter today's date. And the first thing the patient needs is soft tissue management 2, or we abbreviate that as STM2. Soft tissue management 2, or STM2. And the reason is because the patient has light to moderate periodontitis. The diagnosis would be light to moderate perio. The next thing the patient needs is tooth number 19 needs a surgical extraction and bone graft. And the reason is because the patient has advanced bone loss and mobility 2. Mobility degree 2. So tooth number 19, surgical extraction and bone graft, because the tooth has advanced mobility and bone loss. So on tooth number 19, we're also going to be replacing that tooth with a dental implant, abutment, and crown. That's going to be part of the procedures we're going to be doing on this patient. That's the treatment plan is extraction and then implant, abutment, and crown. Now, the next thing is for tooth number 12. Tooth number 12. The patient needs a composite on the occlusal surface. So number 12, occlusal composite. And the reason is because there is recurrent caries. That means the patient already has a filling there and it has decay around the filling. So tooth number 12 needs an occlusal composite, and the reason is recurrent caries. Tooth number 22 needs incisal facial composite. So number 22, IF, and the reason is because the tooth is chipped on the incisal edge. Number 22, IF composite, chipped incisal edge. Then tooth number 29 needs a composite too on DO, number 29, distal occlusal, DO composite, and the reason is caries. And then tooth number 30, we need to cut and remove a PFM, that's porcelain fused to metal crown. Cut and remove a PFM. That means the patient has an existing crown already, and it needs to be cut and removed because there is recurrent caries also under that existing crown. So that would be the diagnosis, recurrent caries under existing crown. So since the patient has an existing crown and we're removing that crown, tooth number 30 will also need a gingivectomy, a buildup, and a crown. Gingivectomy, buildup, and MFC, which means metal-free crown. So tooth number 30, cut and remove existing PFM, and gingivectomy, buildup, and crown, because there's recurrent caries under the existing crown. And the last thing we're going to recommend for this patient is a night guard. a night guard. And this is going to be a night guard for the lower arch. And the reason is because there's attrition or wear damage, wear. So there we go. This is the end of example number 1. So I'm gonna go on to the next slide so you can compare and make sure that your notes are about the same as what we have in the example. So take your time to compare this one. And once you're ready with this one, you can jump into the next video where I'm gonna have the second example.